The challenge in medicine today is that you expect it to be thorough, not miss anything, correct? And also document everything you did, as well as give good patient care, all in the space of 15 minutes for an established patient and 30 minutes for a new patient. It's almost impossible to do, especially using paper charts. EMR solves a lot of those duplication problems because somebody up front puts the data in, or I put the data in once, and it filters into all the different places it's supposed to go to. gloStream came with a lot of advantages. It was based on a word-based platform, so I could create templates very easily. I could edit ones that I've created that I find are not that efficient. And a very big advantage is it has a dashboard that you can do mostly everything on without leaving the room or taking away attention from the patient. When I go to write any prescription in gloStream, it has an inbuilt medication list which gets updated. So apart from medications, it has diabetic test strips, it has nebulizers, common things that we use. Other EMRs do not have it. The training was thorough, it wasn't rushed, and after we were done, we had a day or two with the actual trainers in-house with us, and whilst we're going through that learning curve, they would help us with various little tricks here and there to get us up to speed. It worked well. We cut down from a patient every 15 minutes to initially a patient every hour for about 3 days, then a patient every half hour for another week. At this point, I actually see more patients alone than I used to when there were 2 doctors with paper charts. We had lots of areas that could be improved, but we had no way of implementing because we had no support and the software did not offer it. For example, if you want to do electronic prescribing, it did not offer it. There's nothing you can do. However, I spent enough time reassuring them and preparing their minds that it's just going to be it's change, yes, but it's going to be good change. And I think everybody adapted very quickly. Most of them, because everybody knows how to use Microsoft Word, and the dashboard is friendly and colorful, and most functions are intuitively obvious. It was pretty easy to navigate. The old way would be I'll see a patient, do my notes, create a super bill, give it to the biller, they create a claim, mail it to the insurance, and hope to get paid in 2 months or get denied. So I'm getting a check or electronic deposit in 2 weeks. So the revenue side, it's increased. I don't undercode. If it's a complex case, I will have the documentation to support the appropriate billing code. I'm also able to see more patients per hour. So overall, the net is a big plus. Very important and very practical, because as you know, with EMR, if you come in the morning, a lot of times it might be a Monday morning and something is not functioning, you're not working. He's able to, without coming on site, remote in as well, and look at my server and effect the fixes. Then I'm able to breathe and start seeing patients. So it's a huge plus, both preventatively and proactively for when there are problems. I'm more productive and efficient with gloStream because I spend way less time creating very thorough documentation. I'm able to code appropriately and build insurance appropriately, and I'm also able to avoid a lot of repetitive documentation which you had to do in other modes of practice.